Hi, it's a pleasure to be here today to talk with you. Unfortunately, though, the circumstances are obviously not pleasant and not good and tragic. That is the topic of the day, which is how is the world coping with COVID. So I'm not a health expert, but and so apologies if this is wrong. But my understanding is that the data in Pakistan, as compared to many other countries, is actually fairly good regarding its management of COVID and the case count. But of course, this has come at undoubtedly a high cost in terms of economic cost. And so one of the things that has been striking as we've been working around the world is that there is a dearth of information at the ground, at the household level. It really helps us understand what are households doing to cope with the economic shutdowns that have been taking place. And these shutdowns have happened because of various policies and fears, and also very rational, sensible desire to not be a part of spreading this horrific virus. But with that desire to not be spreading the virus comes with a reduction in economic transactions, a reduction in mobility, and that does obviously have its costs and hardship that creates for many people. One of the things that we've been doing in collaboration with several other partners, is to try to collect information across the world, on what is actually happening. What are the levels of food security that households are facing? What's the lost income? What's happening to increases in tension and depression and conflict? And some of the results that we've been finding are striking, with reductions in food security that are quite steep. Where the households having to cut back on the number of meals and the portions that they serve because of lost income, because of increased prices. And these are at such levels that they really are a call to action from NGOs, a call to action from those who do have resources to support extended family and neighbors, and to support philanthropic organizations that are working hard. And of course, at this scale, it is an absolute call to action to government to step up and protect those who are less fortunate, who are being hit hardest. And a lot of times those are people in the informal economy too, where there isn't an existing infrastructure. It's not as simple as working through the employer to see that people are paid still and things of this nature, which is how, for instance, in the United States, a lot of the social protection has taken place. So in the short run, there's two types of policies that we've been seeing happen a lot, and we're helping to do as much as we can to work with governments to both understand how best to design these policies, as well as how to do some rapid fire measurement and find out, are they working or not? Are they helping? The first is our social protection programs via cash transfers, typically, or food transfers, where in a lot of cases mobile money is the path for distributing money, and it has huge advantages, particularly exactly in this context with a pandemic where physical contact and physical field operations are discouraged. Mobile money has huge promise for the obvious advantage that you can send the money electronically. And so we're seeing many countries take strong and fast action to distribute cash via mobile money. And we've been working with several to understand what is the impact of such a program. A second area that we're seeing a lot of activity is obviously on the health messaging side. How do you get people to rapid fire shift a social norm, wearing masks, making that a part of daily life, understanding how to wear a mask, little simple things like it should cover one's nose. Believe it or not, a lot of times I'm out myself in America, going into a gas station, and it's striking how common you'll see somebody wearing a mask that simply doesn't cover their nose. And there's not too much point to doing this if it doesn't cover your nose. There's been some famous photos in America of some of our politicians, unfortunately, wearing masks without putting it on their nose. So there's a lot of work that does need to be done. How do you shift the social norms? How do you get how do you help people get the right information, the true information? There's so much misinformation going around. And that's an important challenge. And there's a lot of work that can be done at the country level, doing various disseminations of information and trying to understand what spreads, what does not, what is believed, what is not, in order to help get people the right information at the right time.